Paula, thanks for coming in today and spending this time with us. I was saying that we've only had one previous patient in the Cancer Stories programme with a kidney cancer or renal cancer, so we appreciate you coming in today. Can we start with the question about how you were diagnosed, and were you quite well in yourself when it first came about?
I've always had health problems and they varied, such as hypertension, arthritis, but nothing that I would define as life-threatening.
Yes.
But I've always suffered with sort of feeling tired. But I just put that down to my sort of hectic life, that I get up early, I've got children, you know, and I work as well. So being tired is part and parcel of being a mum. However, I was told in 2009 that I was anemic, but bearing in mind that I'd had my last child in 2008,
yes.
So I just assumed that it was all part of sort of the pregnancy and being an older mum. But I've since now been told that that was possibly a sign that something was wrong with me, that I possibly had kidney cancer, because...
You think it might have been developing back then?
Yes, that's what I was led to believe by the consultant that I saw within Leicester General,
yes.
that it was a strong possibility,
yeah.
that it was linked to sort of my anaemia in 2009.
So you had that anaemia and then maybe fatigue as well?
Yes,
but, what was the thing that really led to it being investigated?
Well, as I said, I've always been a plus-size person, as you can see. I've never won the battle with my weight. And with having sort of a 4-year-old daughter, I want to be around to see her grow up.
Yeah.
So I knew that I wanted to go through the programme of the weight loss surgery, but I couldn't tell my family. And the reason I couldn't tell my family was my youngest brother lost his best friend to the weight loss surgery, because he opted and paid for that privately.
I see.
So I knew that if my family knew that I was even thinking about it, they would talk me out of it. So I didn't say anything, and I jumped through all the hoops and went through all the appointments, and it was basically a formality. They said that everybody has to go for what's known as a pre-assessment before you have your surgery, where they take your blood pressure, take bloods, check your blood pressure, etc., just to make sure everything's okay before you have the procedure. So you can imagine my shock to then get a phone call to let me know, sorry, I can't have the procedure because they found some abnormality, but they didn't go into any details or tell me what was the problem. So as far as I was concerned, I was thinking, you know, what's wrong with me? I went to Leicester General for my appointment following this phone call. And it's at this point I'm then told that I have kidney cancer, and they could see some shadows and suspected it had spread. And based on that, they gave me a prognosis of 12 to 18 months. And it was like I was sitting there being given this information, but it wasn't being given to me. It was like it was telling somebody else. It was like a daze that I had to say, run that by me again. What did you just say to me? And it's like, then when he said it again, and then I had time to digest it, that's when I just went to pieces. And I was actually on my own, you know, because I didn't go with anybody, because I didn't know it was that type of a...
I guess you weren't expecting that information to come over.
No.
Do you think that process could have been handled differently looking back?
As a result of... People that know me know I'm a bit militant. I like things to be done right and correct. And as a result, I made a complaint to various people and said, look, you know, I sat in the waiting room and saw a young lady go in and come out, and she was in tears. And I didn't know that within 5-10 minutes, I would be another person coming out in tears. So something is definitely wrong in your process. So as a result of me complaining, they've now changed their they've told me they've changed their procedures.
Yeah.
It is now the consultant's responsibility, who is given the news about a patient, to let the patient know, so that then when they are going for the appointment to see the oncologist, you know, they know what they're going about.
So in other words, when you were referred to the oncologist, the first consultant had more information than you knew at that time.
Yes, I didn't know anything.
And they could have been more upfront with you.
And
perhaps.
now, as a result of the changes, it will be that consultant's responsibility. So the person that was going to deal with the bariatric surgery,
Yes.
who pulled the plug because of the complications with my health, it's now his responsibility. He should have told me.
I understand. If he has further information,
Yeah.
he should be honest with you, basically.
Yes.